Well, good morning. It's Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, New Canaan. And again, as always, I'm apologizing for the horrendous title of my podcast, but I hope you do learn something, and I appreciate your feedback. Well, it's almost the end of January. We're off to a good start, a little chilly start to our new year, but it's just the same. What I wanted to go over with you today is not so much a soft tissue technique. It would appear to be a soft tissue technique for pain control. So what happens, the term I apply is called Trigenics. It was something that I learned many years ago. And what happens as a chiropractor, I'm very focused on the structural component of pain, okay? Bone goes out of place, it causes you pain. Pick up the phone, you call me up, you come in, we make you feel better. But a lot of times it's a little bit deeper because the pain circuits work very interesting. There's more than one way a pain circuit gets back to your brain for you to assess it and whether or not you want to treat it or not, or strong enough to get your attention. So the way we go about doing it now is with it's called Trigenics. It's more of a resistive exercise with nerve sensory manipulation and breathing biofeedback. So I know I just threw a lot at you, so I'll repeat it again. So it's resistive exercise neurology with nerve sensor manipulation and breathing biofeedback. And what it does is it retrains the brain to change the way it signals the muscles in the body. Okay? So putting the bone back in place is wonderful, and that's the core of what a chiropractor does, not necessarily the complete package. And when we add this in to our treatments, the Trigenics, we get a much better result, I think. And it's a more demonstrative result as well because the patient can see a loss of strength and a gain of strength. Whether or not it is in sync with pain reduction, it's still a positive step. If something is weak and you're able to make it strong, there's a good chance that the nerves are working again. It should be something to note is that, nerves, there's 9 different types of nerves. Only 2 deal with pain, okay? And those ones are the ones we're kind of working with here to send the right feedback to the brain. So it's a very good technique, but it's also a lot more complete because sometimes people say, once you get adjusted, do you have to keep getting adjusted? Not necessarily if you solve and reconnect what's going on. Okay. So we call it a multimodal stimulation approach used in Trigenics. And it's kind of consistent with the principles of neuroplasticity. Neuroplasticity means that your brain can grow, change, and adapt. Okay. And so what we're trying to do is organize and synchronize the somatosensory and the sensorimotor systems in the body along with just getting you out of pain. Listen, I know the reason people pick up the phone and call me is because they're in pain. It's not because of my good looks or my charm. I know that much. But what I'm trying to get at here is you have a further enhancement of the treatment by using Trigenics to enhance neuroplasticity and the corticoneural systems together, make them work much better together. And you'd be surprised. I think the results are much more longevity to those particular things. So you try to think of a motor unit. It's like if someone comes in with a knee pain, you have to check some of the stomach muscles, the thigh muscles, the back muscles, the structural stuff, and we look at it as a motor unit. And by addressing the motor unit, we're going to get typically better results. Now, I'm going to come up with a topic. This is a great Scrabble word: dysafferentation. 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 Okay? And dysafferentation is when basically your brain cannot communicate with that muscle or that body part. And this is a neurological, not a mechanical based treatment, which is what Trigenics does. So let's take it and make it a little bit simpler because injury or stress to muscles or tissues causes insult to mechanoreceptors. Okay? This will lead to what we call dysafferentation. Okay? So you have injury or stress. Listen, tennis elbow could be a form of, or carpal tunnel can be a form of stress. Okay. Now, injury is more obviously, you know what an injury is, a car accident, you slip and fall, or you pick up something the wrong way. That's disafferentation. Okay. It leads to disafferentation because your mechanoreceptors, these nerves, are not picking up the information to send back to the brain. And so that's a problem here, is because you have to reconnect those mechanoreceptors. And it's not always just done with structural stuff as far as the vertebra or the spinal bones with just the chiropractic adjustment alone. In this case here, the muscles and the soft tissue undergo stress response to the mechanoreceptors not working, and again, disafferentation. So let's dive into a little bit deeper about disafferentation, what exactly it is. The nerves are not working properly. They're imbalanced, okay? And it goes throughout the whole neurogenic chain. As I said before, if you have a knee problem, you have to check some of the stomach muscles, psoas, iliacus, quadratus lumborum, multifidus. Then you come into the gluminimus, medius, rectus femoris, pes serene, tibialis anterior, posterior. I'm just throwing names at you as all part of the kinetic chain. So if you have a knee problem, you have to look a little more globally than just where the pain is if you're going to get a true healing response. So a disafferentation it causes neurological inhibition or over-facilitation of muscles, making them either functionally weak or short. And this creates an imbalance pattern in the neurokinetic chain, and it causes problems a little bit deeper with your pain levels, okay? So in other words, muscle, the nerve is either getting the brakes put on or the gas put on. So an inhibition is the brakes being put on, and over-facilitation is the gas being put on. And so that makes the tissue either weak or short, and that creates an imbalance. And if you don't address the imbalance, you're really just scratching the surface as it relates to someone's pain syndrome. So the Trigenics is in addition to what we do as chiropractors. Many chiropractors do use it, but it's a very effective way for us to delve in and really solidify a solution for whatever pain you present with. Also too, like I said before, these are great Scrabble words. So disafferentation, disafferentation. So there's two different ways that we're going to treat this disafferentation. We're going to do what's called a muscle spindle activation to strengthen a muscle, and a Golgi Tendon organ activation to lengthen a muscle. And this, what it'll do is it's going to help us correct the functional imbalances in the neurokinetic chain. Once again, the neurokinetic chain is like, you got a knee problem, you got to start with those stomach muscles, got to go to the back muscles, go all the way down to the feet. And when you balance it out, the body you're taking out a large part of the pain syndrome, because when you have a muscle spindle cell and a Golgi tendon cell working properly, they will help contribute to a proper neurological circuit going to your brain, which in turn inhibits pain. So that's a really key part of, I think, why we're successful treating certain things. So when movement is initiated, it's controlled neurologically by the sensory-motor system, and any interference will change the neurokinetics and cause imbalanced biomechanics with pain and dysfunction. Okay. Now again, when I mentioned DYS function, I think you're going to be able to spell that, so I won't go into like disafferentation. So earlier on, we mentioned mechanoreceptors. Mechanoreceptors are pain receptors, and the name for a pain receptor specifically is a nociceptor. And what will happen is when you take an Advil relief, you're just tapping into the nociceptor. And sometimes that works. It gets you out of pain. You're happy. Don't call me. That's fine by me. But chances are, if there's an irritation or disafferentation, you're not going to get a long-term result with it. And that's where Trigenics, along with balanced chiropractic care, and of course the proper home exercise and physical therapy, will make a big, big difference in how you heal on a more long-term level. Because if someone comes you go see a chiropractor or your physical therapist, and you're out of pain for 3-4 months, and comes back 6 months later, you didn't solve the problem. So you go back and you start all over again. It's a very important step to do a complete job here. So what happens here, we want to change how those nociceptors are working by stimulating the muscle spindle cells and the Golgi tendon organ cells. Now, without getting too crazy with neurology, what happens is when the nociceptors, the pain cells are stimulated, it travels up and terminates in the spinal cord, in the brainstem, and it goes to many different parts. It goes to the limbic system, the frontal lobes, parietal lobes, the cortex, and temporal lobes. So you're hitting, there's a lot of different ways your body knows that, hey, something's really wrong. So what Trigenics does and why it's so effective is resisted exercise with muscle treatment and focused breathing. This is the synergistic components that get you out of disafferentation and leading a more pain-free life because your nervous system is working. Okay, so that's in a nutshell. We call it Trigenics. It's a very, very effective way to deal with long-term chronic pain and beneficial results as well. And we hope that you would want beneficial results. I'm Dr. Brian McKay. If I confused the crap out of you today, I'm sorry, but it's a very important term in that you can get results, lasting results, if your care is directed properly and you do a full job from top to bottom. All right? If you have any questions, you can reach out 203-656-3636. 203-656-3636. Listen, thanks very much for listening. I hope you learned something. If you got a question, fire away, and have a wonderful day and stay warm if you're in the Northeast like I am. Thank you very much. Bye.